Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hi, I'm Ruth Warner, and I am happy to welcome you to another episode of Research Perch, where I and my good friend, Dr. Geraldine Cameron, president of the Massage Therapy Foundation. Yay, hi, Geraldine. We'll take apart articles that we feel are particularly interesting and relevant and maybe even exciting for massage therapists to know about. It is always a lot of fun to spend a few minutes talking with you, Geraldine, about unpacking some of the findings that are being generated about massage therapy research today. So today's article, say it again.
Research is fun.
Research is way fun. So today's article comes to us from a journal called Medical Science Monitor Basic Research, and it's an article out of a group in Thailand. And the primary author is someone whose name I'm going to try out of respect to pronounce, but I will probably get it wrong. And it is the primary author is Urewan Chachawan. And then there are several other authors. And the title of the article is Effects of Thai Foot Massage on Balance Performance in Diabetic Patients with Peripheral Neuropathy. And this is a randomized parallel controlled trial. So maybe Geraldine can help us understand exactly what that means. But just to give you a quick overview, this is a trial in which it's fairly large size. They had an N of 60, where they used some extremely well-described traditional Thai massage on the feet and lower legs versus a control group for a relatively short period of time. It was really only 2 weeks of people who had peripheral neuropathy related to diabetes. And what they were looking for was to see whether this would have any impact on specific measures about function of balance and movement in the feet. So they were looking at one-legged stance, a test called timed up and go, which is sometimes called the tug test, range of motion at the metatarsals and the ankle, and also I think also at the knee, and sensation. Because all of these are impacted negatively by peripheral neuropathy, which of course can lead to the risk of falls, and without good nerve sensation, then there's the risk of ulcerations and other. So this was a group of investigators wondering if traditional Thai massage might make some improvements for people who have diabetes and peripheral neuropathy. So that's the quick synopsis. Geraldine, do you want to talk a little bit about what a randomized parallel controlled trial is?
Sure. So clinical trials. Are you hearing an echo?
Uh-oh. Let's try that. Say it again.
Clinical trials, there we go, are the strongest study design that are out there. And so if we look at the pyramid of study design hierarchy, clinical trials are at the top, and then review articles are above that. So they're really the strongest study design. A parallel controlled trial, anytime you see controlled trial, that means there's a control group. And so a control group is a comparison group. Either it's no treatment or a placebo, or in this case, it's just usual care. So they came up with what usual care would be in this. And parallel just means that when people get randomized, they go into one group or the other, and those groups move along in parallel. So they're at the same time.
Oh, okay. Well, that makes it fairly simple. Yeah. So in this trial, we had these parallel groups of, I believe it was a total of 60 people, and who were living with peripheral neuropathy. And so just to give our listeners a tiny bit of background on what that means, it refers to nerve damage in the legs that occurs with long-term diabetes. And that can lead to loss of movement perception. It can lead to loss of sensation. It can lead to decreased proprioception and poorer reflexes. And so now we have a risk of falling, we have a risk of diabetic ulcers, we have a risk of lots of other complications related to peripheral neuropathy. In addition, peripheral neuropathy can also be quite painful. And so in this group, what they wanted to ask was whether what they called deep massage pressure might improve some of these peripheral neuropathy signs. And they did a really nice job, I felt, of describing the intervention. There's a really excellent illustration of what this looks like in doing this. And they did 30-minute treatments 3 times a week for 2 weeks. So that's a fairly intensive treatment session, treatment frequency and duration, but the study length of time was only over 2 weeks. So each patient in the study got a total of 6 treatments of 30 minutes each. And again, our measures were this timed up and go, the one-legged stance, range of motion at 3 different spots, and then this test for sensation, for clarity of sensation with filament tests on the skin of the foot. One of the things I really, really liked about this study was the described their protocol. I felt it was, especially for an American audience not trained in traditional Thai massage, that it was really clearly described and quite succinct, but something that would not be that difficult for someone with a baseline of training to be able to reproduce. And I thought they did that. I thought they did that in a really clear and elegant way.
Yeah. I even liked how they described the control group. I mean, they didn't just say usual care. They said 10. They used 10 guidelines for foot self-care. The patients came in 3 times per week for 2 weeks as well. So they came in at the same amount of time as the actual treatment, the massage group. And they talk about what they were encouraged to do to practice active foot exercise in the direction of ankle dorsiflexion, plantar flexion. They talk about some of the different self-care habits that they suggest. And so they do describe the control group as well, which isn't always common in clinical trials. Right.
Yeah, no, that's a really good point. That's a really good point. I think they did a nice job. And so do you want to talk us through then a little bit about the methods and results and some strengths and weaknesses that you see?
Oh, sure. So as Ruth was saying, in this study, it was over 2 weeks. And what they did was on the first visit, they measured these 4 different outcomes. And so it was kind of pre-post measures. And then they also, at the end of the 2 weeks, measured again. So there's 2 post measures. There's the baseline before any treatment. There's after the first treatment. And then there's 2 weeks later, how are people doing? And the 4 different measures, they had timed up and go, which is them actually standing up in their seat, walking a little bit, turning around, coming back, and sitting back down. That's not easy for some people, especially people with balance problems. There's the one leg standing, so you stand on one leg. How long can you stay like that without putting your other foot down? There's range of motion of the ankle, the metatarsals, the ankle, and the knee, and then there's sensation of foot. And what they found was that in both groups, people got better with all 4 of these. So in clinical trials, we don't, it's important to know, do people get better in the treatment groups? But really, it's most important to look at, can you compare the 2 groups and which group did better? And so for this study, we're interested in which group or which outcome measure did the massage group do better in. And so we found out that the massage group did better in the timed up and go. And in fact, they did so much better that it was considered clinically significant. So usually we look at statistics, we look at the numbers and are the times different, but it doesn't always equate to clinical significance. And in this article, they talked about how 1 to 2 seconds better is clinically significant. It makes a difference in a person's everyday life. There was no difference between the groups in the one leg standing. But if you actually look at the amount of time that people can stand on their leg in both groups, it's significantly different. So they go from, let's say, 33 seconds all the way up to 1 minute and 10 seconds. So, they're almost doubling how much better they are, but they doubled in both groups. They got better in both groups. For all of the groups, the range of motion was better in massage for the most part. And for the foot sensation, the massage group did better in terms of how can they feel on the bottom of their foot. And so they use this one specific test as to determine, can you feel the bottom of your foot? And so with the massage group, it was significantly better than this control group.
So basically what we found was the timed up and go was a significant improvement. The sensation on the bottom of the foot was a significant improvement. Range of motion, particularly in the foot and ankles, improved, all compared to the control group. But the one-legged stance was about the same between the two groups.
Right, exactly.
A decent synopsis. One of the things that this article, that this project did was so it's a project in Thailand, and they used an approach to massage that is accessible and acceptable, and so they went with traditional Thai massage, but they in speculating on mechanisms, they went a very sort of allopathic medical filter or viewpoint on looking at what they thought might be some of the contributing factors for why they got these responses. And I thought, I'd like us to, look at that paragraph for a minute, because I think it's something that as a reader of research, I am always really interested in. Mechanisms are fascinating, but probably the single hardest thing that there is to study about massage therapy. It is sort of the responsibility of researchers to take a stab at why they think things happen the way they happen. But I think some people do this sort of better and more responsibly than others. And I really liked the way that this group discussed that. So I'm looking in the section under the discussion section, where they say the mechanism underlying the effects of Thai foot massage on dynamic balance in diabetic patients with peripheral neuropathy remains unclear. However, they put here that they think improvements of range of motion and skin sensation using deep pressure and stretching could be related to the improved dynamic balance, and that the pressure combined with gentle distraction that's pulling and manipulating on the foot and the lower leg could increase local blood circulation and stimulate the somatosensory system, including all those multiple receptors, in all of the fascial planes on the feet. And I was very compelled by this idea that the relationships between the timed up and go and the range of motion, can lead to improved ankle range of motion and balance. And so, to me, as someone who is looking for application, what can our listeners take struggle with balance, whether it's or age or other affect foot health. To me, there's some question here of the simple manipulation of the dust to gravity for improved function and safety.
Mm-hmm. Yeah, and the thing I really like about their mechanisms discussion is they're very complete. They're looking at it from many different ways, but they're not promising or guaranteeing or saying, therefore, this study proves that this is the mechanism. And so they raise great questions, but they don't say, and this study answered these questions, because that's not what the study is about.
Yeah, that's actually kind of a red flag when you read a study that says we have now proven definitively for now and all time, a study that you can put into the circular file. So
we have to be careful with how
Geraldine, if you were going to...
Well, I'm saying we have to be careful with how we describe a study. When we look at this, we shouldn't then take these results, and go to our local gerontologist and say, this article proves that massage can help with range of motion or with, different mechanisms that it's talking about, because that even though they talk about this might be the way it is, that's the way that we have to be presenting it as well, that this study might show this, but we don't definitively know yet.
Right. Well, and so we can say the study demonstrates that for this group of people, we can predict these kinds of results. But that's, really that's what we always do.
Right.
We look for what studies demonstrate as opposed to proof. And that's a language thing that I'm really happy to, to promote our colleagues being familiar with. Yeah. So if you were going to suggest some follow-up questions, some sort of discussion items, if a classroom wanted to look at this study, or if a journal club wanted to consider spending some time with this study about massage, Thai massage and peripheral neuropathy, what would you suggest?
Well, I think first, this article describes Thai massage as deep tissue. And when I first read that, I think it was in the introduction, and I thought, really? You're doing deep tissue on these folks that have diabetic neuropathy? And so it made me really wonder about, are there any concerns with doing this form of massage? They did not in this article talk about side effects. I have to assume that there weren't any, but there might have been. And so, I guess with this article, I just wanted to have a conversation about, are there any concerns about this form of care with older diabetic patients? So that would be one of the first questions I would ask a group, what they thought.
And a very important one. Yeah.
I also really like your line of thinking, Ruth, about the mechanisms of action. And I think it would be fun to talk within a group about, let's look at the mechanisms that they describe, and are they biologically plausible? Which ones make the most sense to us, and which ones might be kind of far-fetched? And so going through the list of mechanisms that they discuss, which ones are really the most plausible explanations, or are they all, or are none of them? And so I think that this study, it's only over 2 weeks. And so, people who have diabetes, that's over their lifetime. And I don't think 2 weeks worth of massage is really going to benefit them long-term, forever and all the rest of their life. And so this study shows that it's beneficial to have massage for these folks in terms of diabetic neuropathy. How do we make that happen? What does that look like? What types of policy changes do we need to have, or what types of training do we need to do? Do other healthcare providers need to get involved? Do caregivers need to get involved? How do people think that this can happen for diabetics? We have so many people with diabetes in our world. And so how can we make this happen? That's what I would think.
Well, if you were every day. So, but I'll take that a step further and go back to applications here. We talked a little bit about how it impacts our decisions in the session room. This could also lead us to something that is sort of a recurring theme for me, which is about teaching people about self-massage, because a lot of this, one person. And I really loved the self-care guidelines that were described in that would be great advice for foot problems. And massage therapists are qualified to teach people about, under feet, or to teach loved ones about a safe way to work with as well. So, I think there's just a lack that gathering data about this common problem in this common population, the quality of life. Can really benefit our clients and our profession.
Yeah, absolutely. And if you're in an area where you can't talk about self-care like they were in the control group, because I really believe that we should be talking about both the massage and the self-care, I'm sure there's plenty of websites that you can direct your patients to in order to find out more about self-care.
Yeah, absolutely. Good. So that brings to the end of this episode of Research Perch. We will have access information for this article available to you. Again, it's the effects of Thai foot massage on balance performance in diabetic patients with peripheral neuropathy, randomized parallel controlled trial. published. It is a free full text article published through Medical Science Monitor Basic Research, a really fascinating new study out of Thailand. And we would love to support your reading this, talking about it, discussing it with your cohorts, and let us know, what your questions are. We'd love to hear from you. So thanks, everybody. Thanks, Geraldine, for another fabulous edition of Research Perch. Be sure and visit massagetherapyfoundation.org for more information, more episodes of the Perch, and virtually everything about massage therapy and research you could ever ask for.
Thanks, everyone. Bye.
Thanks, everybody. Bye.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.